everyone. Welcome to this new episode of the India Insurtech podcast. We have with us today Samara, who's the founder and CEO of Carer. Samara, great to see you and welcome to the podcast.
Thank you for having me, Prashant. Pleasure to be here.
All right. I think what we'd like to do is get started with getting to know you and knowing Carer a bit. So if you can start with an introduction.
So, anyone who asks me about knowing a little bit about myself, unfortunately or fortunately, it comes with the word cancer. I've kind of more or less dedicated my life to this disease, this cause. Unfortunately, cancer came very close to home. My mother was diagnosed with cancer in 2004, very aggressive form of it, actually. And then what followed was years of suffering, deteriorated quality of life, extensive exasperated treatment side effects, and eventually paying off a very, very large treatment bill. 2010, she lost her battle, but that's really when my journey began in oncology. Cutting a very long story short, we wanted to really solve a simple but very large problem, and that is how do we improve health outcomes for patients who are going through treatment, and how do we cost contain? This accelerating cost of care, today it's hitting over $1 trillion globally, probably well beyond that. And what I've come to realize is that 1 in 2 people just are unable to pay off treatment costs. I have personally seen families and people broken because they are just unable to pay off this cost. So that's really been the mission of Carer, that can we build a model that can cost contain on a global level, working with payers in the payer network and hopefully public health systems as well at some point.
Okay, yeah, that's super purposeful, Samara, and of course, comes from a very personal space. Uh, I'm latching on to 2 points that you mentioned, which is improving health outcomes and containing costs. What I'd like to understand is when a person is, a generic person who is listening to the podcast, how do they improve their health outcomes? What's the preventive side of it? I'd love to know a little bit about that.
So, unfortunately, or again, I can say fortunately because maybe it's a little bit more in our control. Cancer is not only genetic. It's a very big myth that the predominance of the prevalence of cancer is because of the fact that there is some genetic predisposition. That plays one factor of it. In fact, the rising cases of cancer is primarily because of lifestyle and environmental factors. So now, when we talk about lifestyle and environmental factors, these are factors at some degree we can possibly control. So, I mean, I'm going to say the generic stuff, which is your smoking, your excessive drinking, sedentary lifestyles, chronic stress, a lot of hormonal imbalances, and women actually having children post the age of 30 can also be a risk factor. So many factors that are essentially biological, lifestyle, and environmental is contributing to the rise of cancer, apart from the fact that we have better screening methodologies and basically more people are screening, so we're picking up more cancers and things like that. But the biggest thing with cancer that we need to remember is that the later the stage, the worse the outcome and the worse the prognosis. So unfortunately, we live in a country where people fear doing screening. They feel that if it's better if we don't do it, and if we don't know, it doesn't exist. And that's really the mindset we live in, which is very, very wrong when it comes to cancer. You have to be diligent, be excessively diligent if required, to do your screening, to be a little mindful of how you're living your life, because these are the contributing factors. And if you pick up cancer at early stages, it's almost 100% curable, and it's very treatable. So I think we need to really push for, I know we hear a lot about health checkups and screening. In fact, the screenings that are there as well are very generic. We have much more kind of personalized screening. We have much better screening methodologies like blood-based tests that are more accurate, that are easier to do. And this is something I always recommend. But yes, and you have to live a bit of a healthy lifestyle. Exercise has become a really important part of, if I can say, prevention. So your BMI, your fat percentage, how you're moving, weightlifting, all of that has to has to be incorporated into your life. It's no more of when I feel like moving and working out, I'll do it. It's now kind of almost mandatory if you want to kind of somewhat decrease your risk of cancer or prevent it.
Got it. Got it. Now, the second point that you mentioned about cost containment, I'd love to understand, how you're able to help patients or potential cancer patients contain costs. And I'd love to know the other angle to it, which is one of the patient angle and the other one is the insurer or the ecosystem angle. If you can, shed some light on both of these areas.
Sure. So Prashant, our journey started very humbly. I was actually in Tata and TMH. I did an observership there and I kind of really understood. So this was post my mother's demise after spending many years in the US. Then I came back to India. I was very fortunate to get to work or at least be under Dr. Shailesh Srikhande, who was then the chief of GI. And I really saw cancer from a very different lens. And wanted to build essentially a platform, a care system for patients who can monitor patients at home. What we realized is that cancer is a long drawn treatment. It goes well beyond 12 months. Majority of the healing or the deterioration of patients happen at home, not in the hospital. And what is a big miss is actually having a system that monitors these patients at home. So when we built that system, we started measuring outcomes such as quality of life, adherence to treatment, distress, multiple other factors. And we used like globally validated assessments to ensure that our data was correct and that if we are offering this care, and we would offer nutrition, physical, mental health support. So we wouldn't intervene in the medical treatment, but provide extended care into the patient's home because there's nausea, there's vomiting, there's nutritional deficiencies, there's pain, there's fatigue, there's a lot of psychological discomfort. Who's taking care of all of this? So that's the system we built, and we measured outcomes, and we saw substantial improvements in just quality of life, in adherence, in patients being able to complete the course of treatment, to tolerate treatment well, and during that course of time, like I told you, our mission has always been improve health outcomes and cost contain. During the time, we realized that a very large proportion of costs that are being covered, whether it is through the patient and their family themselves or through the insurer, is the unforeseen costs and critical events that are occurring because of severity of side effects, because of no management of care at home, and that is leading to patients ending up in being hospitalized, readmissions post-discharge, ICU admissions, ER visits, contracting more infections, so on and so forth. So a lot of the unforeseen events is what we started looking at. So when we started kind of offering the care, by this time we're working with global pharma companies, hospitals, doctors, very, very particular in ensuring that we are showcasing qualitative and quantitative outcomes in terms of quality of life and health outcomes. We started also looking at, can we have an impact on these unforeseen costs? And if I'm not mistaken, globally, this constitutes to about 40% of the overall cost of cancer care. So that's approximately $400 billion that is going for these unforeseen costs. And we have a phenomenal technology team led by incredible CTO. And the mandate was that, can we predict if something is going to happen to a patient? Because by this time, we have worked with thousands and thousands of patients. We have significant amount of data. We've kind of tracked how patients are responding to treatment, what's working, what's not working. So can we build an AI model that can start predicting to great accuracy that, hey, this patient comes on a platform, we do certain assessments, we get an understanding that he or she is going to tolerate treatment this way. There are going to be these side effects. There is a high probability that adherence is going to be low, that they're going to pick up an infection, that they're probably going to be hospitalized. And we eventually built that. And it was, today we're hitting about an 85% accuracy in the prediction. And hence, the model now can forecast essentially what's going to happen to a patient, how they're going to respond to treatment. But at the same time, we have the entire management system at the back end to monitor and to intervene before something happens. So if we start seeing a patient deteriorating, if we start seeing a patient having severe nausea, which is not being managed, they're losing extensive amounts of weight. So we intervene, we try to help with the nutrition aspect of it. We have clinical nutritionists. But still the nausea is not improving. The patient has now lost significant amount of weight. The patient is going to get dehydrated. That's when we kind of prompt them to, kind of have their medical team intervene. But most of the time, none of this happens.
Okay.
None of this happens. So patient invariably loses significant amount of weight, is extremely weak, is dehydrated, and will probably have to be hospitalized. So this is a very simple scenario that happens to a lot of patients that can possibly be managed earlier, and we can kind of prevent that hospitalization from occurring altogether.
Got it. Tell me if my understanding is correct. What I've understood is that while in a general situations, one would go to the hospital, get the treatment done. In the case of what carer is doing, you want to handhold the patient, perhaps pre-screening. Let's say they went to the screening, it came out. From there until the recovery, while there is going to be a straightforward path of going through the medical system, you want to be a layer with the medical system and handhold them, predict stuff for them, help them improve their outcomes and contain costs. Is
And
my
this is,
understanding correct?
yes, and this is primarily for diagnosed patients. So
Okay.
when the patient is diagnosed is when we come on board, or when a policyholder is diagnosed is when we offer the care. We become an extension of care of the medical team. We are not replacing anyone or anything or intervening in the care. In fact, they are very important aspects of care. We just become an extension of care of the management of the patient at home. We understand patients have a dietitian in the hospital. They have other care, possibly even physiotherapy and psychology or psychologist in the hospital. But that all stops once they leave the hospital. And like I said, majority of the deterioration is happening at home, and we're trying to ensure that that deterioration doesn't occur, so that the patient doesn't end up back in hospital for something that could have been avoided.
Okay. You also spoke about, so on one side you're doing your partnership with the hospitals and making sure that you're not replacing them but assisting them. On the other side, on the cost containment, I'd love to know what your go-to-market is for getting customers on board, and what's your partnership like with insurers to maybe contain the costs or even help
Sure.
them reduce their loss ratios.
Yes. So for insurers, obviously the most important thing is that how do we cost contain, right? And if you look at cancer is the number one cost driver for any insurer around the world, or at least it'll be in their top 3 or 5. Like that is a big issue for any insurance company. And I believe it's because of these unforeseen costs, right? An insurer, an underwriter can cost estimate, obviously taking into account what the clinical protocol will be, what drug is the patient going to get, how many rounds of radiation, is there going to be surgery, which hospital facility, all of that you can kind of estimate. But you can never estimate how patient A is going to respond to the treatment, and is patient A going to have severe side effects that's going to result in him or her, ending up in ICU or at the ER at all, at multiple times, or being hospitalized. And, is patient A going to have very low adherence? Because that is a very big problem. If adherence is low, patients are just unable to tolerate treatment. So they stop treatment. Another big issue. So they will stop treatment. They will either take a break from treatment or they will stop it completely. Very, very common in India. And they will go take some alternative medicine. And then they will come back with a progressed disease, where now a stage 2 has become a stage 3 or 4, where they need more aggressive treatment, more expensive. You're spending 60% more on your treatment now with an advanced stage. So adherence becomes very important. So what we do for the insurance company is that we just become a layer of care for their policyholder who's diagnosed. So they're not just a financial transaction, but they become more a healthcare provider that says, hey, because you have been a policy holder of ours, and unfortunately now you're diagnosed with cancer, we're going to offer this to you throughout your treatment. One is because we want to have improved health outcomes for you. And two is obviously for them, they want to offer something that can possibly decrease these unforeseen costs. That will have huge.
It's a great win-win.
It's a win-win, right? So that's basically how we're working with the insurer, and we're being embedded in the policy. So it is not like if they feel like it or anything. No, it's that it's everyone should get access to this, Prashant. That's something I've said from day one. It should not be an option. It doesn't make sense for it to be an option. Like why shouldn't every patient, from irrespective of their background, get access to holistic, complete care that can improve their health outcomes? Like it just doesn't make sense. So the way we work with insurers, not only in India, but now also entering into the GCC and the Gulf and the UAE, is that you have to embed us in the policy. So that if your policy holder eventually does get diagnosed, they have to get access to this care.
Got it. All right. I think what the other data point that stuck with me is that you improved your prediction accuracy by 85%, which basically gets me into segue into a topic which everyone's interested to know, which is how are you leveraging AI? What have you done? How have you leveraged AI to improve the prediction accuracy really on your side?
So I'm not a tech expert, so this is where my CTO and my tech team would come in. Having said that, what we have seen, everything relies on a really robust data set. AI is only as good as what your data set is. And for us, luckily, we've been very, very diligent with the kind of data set we've built over time. And today we hold one of probably the largest multi-dimensional oncology data set in Asia. And longitudinal. So we've been tracking and we've been monitoring and we've been kind of, working with these patients for many, many years. So our data set right now is over 10 years long. So it's a pretty long data set. It's very, very rich, very wide. So we don't only collect clinical data, we also monitor nutritional, physical, socioeconomic, psychological adherence. So this is what I mean by multivariate, multidimensional. So the data set per se has been the foundation of having a really strong AI model. And I think it will always be. It's not a synthetic data set, it's real world patient data, 100% proprietary, owned by us. And it has allowed us to build models like this. The accuracy was built out of that. So because the data set was so robust, I think at our first try, we had a really high accuracy. And now as we kind of capture more data points, work with more varied set of patients, that accuracy goes up. So I have to give the credit where it's due, and that's essentially the data set that has allowed us to build very strong AI models and leverage AI. And of course, now there's so much more we can do, because once you can forecast what's going to happen to someone, you can really intervene and essentially sort out, a lot of things for the patient, for the family, for healthcare providers, and of course, insurers as well.
Yeah, that's impressive stuff, considering you've really put the discipline, the sincerity. You and your team build out, depth and data, which is now helping you improve outcomes. So I think AI is, of course, a great layer for that. But Samara, I think this has been a lovely chat with you. Our members are going to be really, happy listening to, the progress you're making and the problem you're solving in the market. I hope you impact more and more lives as you move forward on this mission. We at IIA, of course, wish you our very best and would love to see you succeed.
Thank you so much. We're so excited to be a part of IIA, and we're hopefully we'll connect soon again. Thank you for this conversation.
Thank you.